seek mental health treatment monthly across the three parishes, pushing the region's already strained public health system to the brink. Clarendon is bearing the heaviest burden, with approximately 8,000 cases per month, followed closely by St. Elizabeth with more than 6,000 and Manchester with about 4,000.
I have a small baseline I use. When I started in community mental health, I had a small clinic in Lyman Town of about 30-40 patients. Now in 2025, I am seeing over 100 patients in the same clinic, same space, and every single opportunity you get to go to that clinic, you are having 5-6 new persons.
Kevin Allen is the nurse practitioner in charge of mental health in the southern region. Mr. Allen says despite the growing need, healthcare professionals on the ground say they are battling this mental health crisis with their hands tied, citing chronic staff shortages, medication, and facilities.
The example I will use is our transportation. One nurse is assigned to each parish. But if there is an emergency, so I'm in Manchester, and I'm in Manchester in Mandeville dealing with a crisis, but Christiana comes under my team as well. If I have to go to Manchester, I don't have any resource to respond to the crisis, and therefore a lot of the time we are not able to do the service delivery as we would want because we don't have the resource. We don't have a budget assigned to mental health, so we have to use the resources that the region would provide.
They are now issuing a public appeal to the health ministry to make mental health a national priority.
Bellevue as an institution would have a budget, but community mental health does not have a budget. And if you don't budget for community mental health as a part of your overall scheme, how will you meet the needs that arise in various communities from that? More health promotion, more health education, a greater push at preventative than curing. We're managing the conditions, but we have to make more effort to put preventative measures, meeting the communities where they are.
Nurse practitioners are concerned that if the government doesn't do something to address the issue of mental health in Jamaica, the situation is going to get worse, especially among young people. Reporting from Trelawney at the Nurse Practitioner of Jamaica Conference, I'm Shimana Pullen for TVJ News.